Despite receiving a serious diagnosis, my next guest, Ann, tries to live her life as fully as possible.
When your breast cancer goes into remission, all you want to do is focus on living in the present. But 12 years after I was diagnosed with early stage breast cancer, I was then told I had metastatic breast cancer. I take one day at a time. I've learned to integrate my breast cancer care and treatment into my day-to-day. I enjoy walking, hiking, skiing, volunteering, and working in my garden, and I really look forward to traveling again. There are wonderful opportunities for me to experience, and I see each day as a blessing.
Well, joining me via Skype are Ann and her oncologist, Dr. Hope Rugo, professor of medicine and director of breast oncology and clinical trials education at UCSF. Now, Dr. Rugo is here at the request of Novartis Oncology, our segment sponsor. Now, she is not being compensated for this engagement. Now, Ann, your cancer reoccurred after 12 years. How do you feel now?
Good. I've been living with metastatic breast cancer for a while, and it really makes me appreciate every minute of every day.
Oh, I can imagine. Dr. Rugo, tell us about the type of cancer Ann has.
Well, metastatic breast cancer means that Anne's breast cancer has spread to other parts of her body.
And there are subtypes of this particular disease, correct?
Yes, Anne's subtype is hormone receptor positive, HER2/neu negative. That means her tumor has receptors for hormones, so estrogen or progesterone can help the cancer cells grow and divide. And there's a treatment called hormone therapy that could help with her cancer.
But there's still no cure for metastatic breast cancer, right?
Right, so when Anne's metastatic cancer started to grow again on hormone therapy, we looked at mutations or changes in DNA in the tumor and found Anne's tumor had a specific mutation in PIK3CA.
So, and what exactly did that tell you?
Unfortunately, this mutation is quite common in hormone receptor positive, HER2 negative metastatic breast cancer. About 4 out of 10 patients with this subtype have the mutation. Women with this mutation typically have a more aggressive tumor.
Well, doctor, once you're armed with this information, what are the next steps?
Women who are postmenopausal or men with hormone receptor positive, HER2 negative metastatic breast cancer with a PIK3CA mutation who have progressed on or after hormone therapy are eligible for treatment with a medicine called Piqray or alpelisib tablets. It is FDA approved in combination with a hormonal agent called fulvestrant and is the first and only treatment that specifically targets PIK3CA mutations in hormone receptor positive, HER2 negative metastatic breast cancer.
Okay, so tell us, how does it work?
Well, Piqray and fulvestrant have been shown to help patients whose breast cancers have a PIK3CA mutation to keep their cancer from growing for almost twice as long as patients who took fulvestrant alone.
Well, and of course, before starting any treatment, talk to your doctor. And as with any medication, there are some important things to know.
Do not take Piqray if you've had a severe allergic reaction to it or any of its ingredients. Piqray can cause serious side effects, including severe allergic and skin reactions, high blood sugar levels and diarrhea that are common and can be severe, and lung problems known as pneumonitis. Tell your doctor right away if you have symptoms of severe allergic reactions or high blood sugar and its complications while taking Piqray. Your doctor will monitor your blood sugar before you start and during treatment and may monitor more often if you've had a history of type 2 diabetes. Before starting, tell your doctor if you have a history of diabetes, skin reactions, are pregnant, breastfeeding, or plan to become pregnant. Common side effects include rash, nausea, tiredness and weakness, decreased appetite, mouth sores, vomiting, weight loss, hair loss, and changes in certain blood tests.
How can someone get information about this?
Understanding what is driving your cancer is critical to finding the right treatment options. Ask your doctor if your tumor has a PIK3CA mutation.
Well, this is great information. I really appreciate you sharing it with us. And I'd like to thank all of my guests today, and a special thanks to Dr. Hope Rugo.
Indication: Piqray alpelisib tablets is a prescription medicine used in combination with the medicine fulvestrant to treat women who have gone through menopause and men who have hormone receptor HR-positive, human epidermal growth factor receptor 2, HER2-negative advanced breast cancer, or breast cancer that has spread to other parts of the body, metastatic, with an abnormal phosphatidylinositol 3 kinase catalytic subunit alpha PIK3CA gene, and whose disease has progressed on or after endocrine therapy. Your healthcare provider will test your cancer for an abnormal PIK3CA gene to make sure that Piqray is right for you. It is not known if Piqray is safe and effective in children. Important safety information. Do not take Piqray if you have had a severe allergic reaction to Piqray or are allergic to any of the ingredients in Piqray. Piqray may cause serious side effects, including severe allergic reactions. Tell your healthcare provider or get medical help right away if you have trouble breathing, flushing, rash, fever, or fast heart rate during treatment with Piqray. Severe skin reactions. Tell your healthcare provider or get medical help right away if you get severe rash or rash that keeps getting worse, reddened skin, flu-like symptoms, blistering of the lips, eyes, or mouth, blisters on the skin or skin peeling, with or without fever. High blood sugar levels, hyperglycemia. Hyperglycemia is common with Piqray, and its complications can be severe. Your healthcare provider will monitor your blood sugar levels before you start and during treatment with Piqray. Your healthcare provider may monitor your blood sugar levels more often if you have a history of type 2 diabetes. Tell your healthcare provider right away if you develop symptoms of hyperglycemia and its complications, including excessive thirst, dry mouth, urinating more often than usual or having a higher amount of urine than normal, increased appetite with weight loss, confusion, nausea, vomiting, fruity odor on breath, difficulty breathing, or dry or flushed skin. Lung problems, pneumonitis. Tell your healthcare provider right away if you develop new or worsening symptoms of lung problems, including shortness of breath or trouble breathing, cough, or chest pain. Diarrhea. Diarrhea is common with Piqray and can be severe. Severe diarrhea can lead to the loss of too much body water, dehydration, and kidney problems. If you develop diarrhea during treatment with Piqray, tell your healthcare provider right away. Your healthcare provider may tell you to drink more fluids or take medicines to treat diarrhea. Your healthcare provider may tell you to decrease your dose, temporarily stop your treatment, or completely stop your treatment with Piqray if you get certain serious side effects. Before you take Piqray, tell your healthcare provider about all of your medical conditions, including if you have a history of diabetes, have a history of skin rash, redness of skin, blistering of the lips, eyes, or mouth, or skin peeling, are pregnant or plan to become pregnant. Piqray can harm your unborn baby. Females who are able to become pregnant. Your healthcare provider will check to see if you are pregnant before you start treatment with Piqray. You should use effective birth control during treatment with Piqray and for 1 week after the last dose. Talk to your healthcare provider about birth control methods that may be right for you during this time. If you become pregnant or think you are pregnant, tell your healthcare provider right away. Males with female partners who are able to become pregnant should use condoms and effective birth control during treatment with Piqray and for 1 week after the last dose. If your female partner becomes pregnant, tell your healthcare provider right away. Are breastfeeding or plan to breastfeed? It is not known if Piqray passes into your breast milk. Do not breastfeed during treatment with Piqray and for 1 week after the last dose. You should also read the full prescribing information of fulvestrant for important pregnancy, contraception, infertility, and lactation information. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Piqray and other medicines may affect each other, causing side effects. Know the medicines you take. Keep a list of them to show your healthcare provider or pharmacist when you get a new medicine. The most common side effects of Piqray when used with fulvestrant include rash, nausea, tiredness and weakness, decreased appetite, mouth sores, vomiting, weight loss, hair loss, changes in certain blood tests. Piqray may affect fertility in males and in females who are able to become pregnant. Talk to your healthcare provider if this is a concern for you. These are not all of the possible side effects of Piqray. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please visit Piqray.com for full prescribing information, including patient information.